But now, because we are the concerned citizens of this country and we have the right to citizens' arrest, I know that most of the law enforcers don't understand that, but we as the citizens, we have that right. Now, if you suspect that there's a criminal activity happening there, then you would need to act as a citizen. So what we have been doing is that we have been visiting these clinics because what we know is that they collect medication, they are undocumented, collect medication from different healthcare facilities, and they go and sell them in their countries of birth. Now, we have seen that in the past month, I think there was a bus going to Zimbabwe that had medication. Now we all know that that's business. They're taking advantage because our system does not talk to each other. When you go to a hospital, there's no way where they capture that so-and-so has just received medication. They go to the second hospital because they know that the system is not talking to each other. So because we are the taxpayers, and I mean, South Africans are angry. You could tell how Mama Emma is expressing herself because nobody taking action. I mean, we are on autopilot. We don't have a president because the president decides to prioritize foreigners over us. I mean, it's been 5 years. We've been trying to engage them.
Yeah.
We've marched to the union building, but nothing has happened. So we're taking it upon ourselves to save this country because we have a constitution and we are guided. I know that they always tell us that the constitution says everybody have the right to health, but they will not tell you that when you are a migrant, you need to come to this country. Section 17 says that when you come to this country, you need to have proper documents. You need to have your work permit if you're here to work, and you would have your medical certificate. Now, you would have insurance that will cover you medically when you're here in this country. But because most of them are illegal, they will not have that.
So,
because most of them don't even have permits, they will not have that.
Zandile, a key argument you've been presenting in the last few days has been that you are entitled to effect a citizen's arrest when you suspect that a person has committed a crime. And you're absolutely right, that is there in terms of the Criminal Procedure Act. But many would say what you are doing is not a citizen's arrest. It is interfering with a right of a person to health care as guaranteed in Section 27 of the Constitution. Granted, you may not like that those people are entitled to the right, but factually as it stands, that's the provision in the Constitution, unqualified right to it. And I don't know, unless I've missed it, I've not seen you effecting arrests. I've seen your members turning people back. Slightly different.
Section 27 says everyone has the right to medical attention. Now, when you are a migrant, you can get, if there's an emergency. I mean, we always say this, that life comes first. If there is an emergency, you will be allowed to go in. But if it's your normal monthly checkups, you know, if you're on chronic medication or something like that, then you need to go to a private hospital where you're going to pay, because when you are a migrant, you must pay.
Where do you get that, Zandile? And I hate to quibble with you about provisions of the law, but because you go there, let me go there as well. Because Section 27, subsection 1 says, everyone has the right to have access to healthcare services, including reproductive healthcare. What you're talking about is Section 27, subsection 3, which then says no one may be denied emergency healthcare. But the initial right is, it says everyone.
But when you go to Immigration Act 17, it says that when you are a migrant, you should have your medical certificate. You should have a medical insurance, basically. So it talks to each other. So you can't be illegal and be a criminal and then expect that the government, because there's that Section 27 that talks about a free medical attention. Now that was for South Africans and not basically for immigrants. That's why there is an Immigration Act that will talk about the medical insurance. So it talks to each other. But now the likes of Human Rights Commission, they don't want to dwell into the Section 17 of the Immigration Act because they know that by law, that's what's supposed to happen. Yes, everybody has the right to medical attention and emergency especially. We don't want anyone dying here in this country. I mean, we are fighting that people need to go back to their own respective country and go and fix. We don't want people dying here. So we will allow you to get your emergency medical attention. But if you are undocumented, we will unfortunately have to hand you over to the law enforcers. And those law enforcers, they don't want to do their work. I mean, I'm sure you would have seen what happened in Rosettenville when we had police officers and we wanted to show them where crime is happening. And they were not keen. They told us straight that they do not have problems with illegal migrants. That takes us to another